To become a great city, a world city, and fulfill its bright vision for tomorrow, the health of all citizens must be at the forefront. But ensuring a healthy population requires a common agenda and full partnership from all of Dallas. Fall is upon us. Football is half over and basketball is just beginning. And so is flu season. To help our entire region be healthier this winter, we interviewed Dr. Angela Moemeka to get her insight on how to keep yourself and everyone around you safe from influenza.
It's important for the child to get the flu vaccine because there are really two main age groups that we start to be concerned about hospitalizations and even death from the flu virus. Children under the age of 5 and people over the age of 65. So if you have any of those age groups in your household, it's critical, very important that you get your flu vaccine to give them that additional protection. In addition, for older people, it's really important that they get their flu vaccine because, again, if there are children under the age of 5 in your household, they are very likely to end up hospitalized should they get the flu virus and flu disease. You also want to talk to your child about general hygiene. So making sure that if they're coughing or sneezing, that they're covering their cough either with a tissue or handkerchief, coughing and sneezing into the elbow, or walking away from where people are if you're going to cough or sneeze. The second thing is making sure you wash your hands, keep your hands clean. So 20 seconds with soap and water or with a hand sanitizer to really make sure you cover all surfaces and clean the surfaces of your hands. Also keeping those hands away from your face as much as possible. Even though your hands look clean, they're not really clean. And that's a good way to bring it up with children. I know with my son, that's how I brought it up with him when he was little, is just because your hands look clean doesn't mean they're clean. And it's very important to wash your hands, not just for your own health, but for the health of those that you're touching, that you're coming in contact with. You really want to make sure that your primary way of getting the flu virus, which is hands with virus on them, touching your face, or someone sneezing, coughing on something, and then you touch that thing, that primary way of your hands being a source of a mode of infection is blocked.
In a typical year, the city of Dallas ranks 5th or 6th in the nation in terms of air quality. Going into flu season, with the virus in the air, children who already have respiratory illnesses or compromised immune systems are at greater risk. This can be especially true for kids who have asthma.
So children who have lung disease, so asthma, other types of pulmonary disease, are really already at a baseline a little bit more sensitive to irritation within their lungs. And what happens is when they get the flu virus or any other virus, they are more likely to react to that virus with bronchospasm. And what bronchospasm means is that your small airways start to close off and they start to fill with mucus. And that's when you start to have symptoms of asthma or of wheezing. So really, it's very important that children who happen to have asthma in the flu season, it's critical that they get their flu vaccine so that they don't predispose themselves to becoming sick with asthma and ending up in the hospital or the emergency room because of that. Even if your child hasn't recently wheezed, you very quickly call your provider as you get closer to the season and refill any medications that you may not have at home. Also make sure that medications are not expired so that you can have that accessible to you in case your child does go on to have symptoms that are concerning. The best place to get your flu vaccine is from your primary care provider, so either physician or nurse practitioner that you see on a regular basis. That is the #1 place to go. You can also get the flu vaccine at a lot of retail clinics, so CVS, Walgreens, Target, etc. have flu vaccines available. Finally, you do have that access to our Dallas County Health and Human Services. They have multiple, I believe it's 6 to 8 immunization clinics around the county that offer free flu vaccines for people who are Medicaid enrollees, who are unemployed, or who are uninsured.